Next up, Joey, what are the specific challenges that the Brunswick community might have in accessing behavioral health services?
Well, I think you said it is access. Access to services has been a huge barrier for not only the Mid-Coast area, but for the state of Maine in general. I'm a returning Mainer, so I have recently migrated back to Maine from Massachusetts, and just the vast differences between those two states is remarkable. I've been fortunate to be here with Sweetser for the last 2 years. And 2 years ago, we did a needs assessment for the community, and the biggest need has been availability of nurse practitioners or psychiatrists in our area, the availability of substance use recovery services that are not in Portland or further south where I have to drive half across the state to get the support we need. So I think that in a nutshell is kind of what the biggest barrier in our community now. Where's hope that we're hoping to bridge that.
Okay, so what kind of resources and programs are available here at the Brunswick CCBHC for those in recovery, and why is this particular walk-in care model important for accessing behavioral health and substance use services?
So for those of you who may not know that Sweetser is a recipient of a SAMHSA grant that we received 4 years ago to start kind of finding out what the Mid-Coast community needed. And so we were allowed for the past 4 years to kind of start building that model in this area. So in the past year, I would say, we've gone from one nurse practitioner that has been able to see folks to prescribe medications as well as medicated assisted treatment for, so we had one nurse practitioner. We now have 3 in our community, so we've just expanded that. We've had one care coordinator, where now we've got 3 as well. We had one therapist. We've got our 4th joining us at the end of this month. So in this building, we have grown integrated care. So it's not just like every other clinic that you go to for that specific service. You walk in the door, so the hope is that you walk in. Currently, our walk-in hours are Tuesday, Wednesday, and Thursday from 9 a.m. to noon. And the experience that a person should have is walking through the door and signing up for the services that we offer. And then you meet with a clinician to be able to triage. Kind of basically, we look for 3 things: is walking in the door, is your needs emergent, like crisis related, meaning that we probably partner with a crisis team to kind of help you get the needs met in that moment. Or is it an urgent need that you might need benefits? You might need referrals to certain places. We can help with that right away. Or is it just routine needs that we would triage folks based on those 3 things? So everyone that walks through the door hopefully has one of those paths to recovery and treatment. Again, one of the areas where we're still trying to increase our development is the substance use disorder services. We've been fortunate to start increasing our partnerships. So Better Life Partners is actually one of our first ones that we did about 6 months ago, I believe, which is where this film was introduced to me. I actually participated in a bath recovery group of networked providers that I just happened to be there that day to kind of tell them about the clinic that we have here, and I made this connection. So I was fortunate that we were able to incorporate this today, and that you've all been able to come. And one for the walk-in is that thing is people don't know where to start. So sometimes just walking through the door, even if you don't get that treatment done right today, you're actually leaving hopefully with the resources that you need to move forward. So, and I think that's the purpose of the walk-in. And we hope to continue to improve that, we hope to expand that actually Monday through Friday from 10 to 3 is our goal in September. With that, in addition to that extra clinician, we're now able to expand those hours and hope to get more people through.
And Joey, last question. What does compassion look like to you in the recovery journey?
To me, this work is personal. Like probably many of you, there's recovery, mental health, substance use is prominent through my family as well as some friends. Just being there for someone, understanding that, again, like what Alyssa said, is that one wrong decision can get you into the same spot. And when you're in that spot, being that person, it's difficult to see the light at the end of the tunnel. Just having that one person is really important towards recovery. So for myself, just recently, 6 months ago, we lost a cousin of mine to one poor choice. He took a bump of coke one night just visiting friends, and someone had offered it to him, and he said, well, no, I haven't really done that in a while. And, and he did, and everyone overdosed who used that night, and he was the only one that passed away. And unfortunately, his funeral was the day of his 8-year-old's birthday. And so I was fortunate to be given that eulogy. And, I actually got a tattoo in his memory just to, one, it's a talking piece that I can now educate others if someone asks me about it. And again, this is personal, but it's also that we need more people talking about this.